heck of a day at physical therapy. Today, my heart rate is going nutty. So I'm having a pretty symptomatic day at an 11 a.m. physical therapy appointment. And I am much worse in the mornings. My symptoms are much worse in the mornings, but I usually do physical therapy in the afternoon, but today I just had an 11 a.m. and I wanted to see how it went because I just wanted to see how my body would do when it's in a more symptomatic state. And I'll show you my heart rate from my hour-long session today. Mind you, this is the good version of my heart rate with POTS. This is very medicated. I take Corlinor, I take Clonidine, I take Verapamil, Losartan. Those are the main ones controlling my blood pressure and heart rate. So this is the medicated version. Just imagine how it was before I was on medication. And if my words sound a little bit slurry or slow right now, it's because sometimes after I work out or just when I'm having a bad day, I'll sound a little bit like I'm drunk, a little bit slurry. It's definitely, I can tend to feel a lot more than people notice it. So I feel like my words are coming out slower and slurry when people don't tell me they don't really notice it as much. But if you watch some of my other videos and you're used to how articulate I sound, I don't probably sound quite as smooth. So I did physical therapy when I was first diagnosed. I did 2 years almost of physical therapy right after I was diagnosed, and I liked it. Do I think that it made a tremendous difference in my POTS symptoms? No, I think it was helpful. Before I was diagnosed with POTS, I worked out 5 days a week with a personal trainer. I was really, really fit. I did a lot of weight training and all sorts of fun things. I loved my gym. And so when I developed POTS and I couldn't work out anymore, it was confusing. I kept getting so tired and I was missing my training appointments and I just couldn't understand why. So for me, when I was diagnosed, starting physical therapy felt a little bit like my old life where I would work out with my trainer. So I liked it because then at least, if nothing else, I was doing something that I felt like I had control over in terms of helping myself. I could make myself go to these appointments and I knew that that was good for me. It depends on your condition. I know that, for instance, people with chronic fatigue syndrome or some overlapping conditions with their POTS, this may not be the right route for you. And additionally, every patient responds differently. And I always like to go back to that because I think that in the POTS world, especially some practitioners are still of a very outdated belief that exercise alone is just all you need for POTS. And that's just not the case for a lot of people. So it can be tremendously helpful for some people not as much. I fall somewhere in kind of the neutral range. I think it's good for me. I like to go, but it is certainly not a cure-all for my POTS. And I think you'll notice that from my heart rate. Today I did some laying down exercises, so some abdominal exercises, and then I also did some arm exercises on like a standing kind of bike thing. And I'm out of breath and really shaky, you'll notice right now. But I think it's important to show this part too. So not just the done up with my makeup and all that jazz when I feel good. So we did some laying down exercises, and then we do some neck exercises because I have a lot of neck pain and I get those headaches, and we're still trying to figure out exactly what's causing those and how to control those a little bit better. So I'll do some neck exercises, both laying down and standing. And then by the end of today, my physical therapist said, do you want to do squats? You don't look like you're probably in a place to do squats today. And I was like, no, I want to do squats. So I want to do them. I like to punish my body because I'm mad at it sometimes. And like, especially on days like today when it's not working properly, I'm like, well, you're not working properly? Then I'm going to do some squats and punish you. Is that the healthiest coping mechanism? I don't know. This therapist maybe weigh in on that. I don't know. That's just my approach. But I will say, I know my symptoms very, very well by now. So I am confident that I know when it's too much. And I know I've never passed out. Lots of POTS patients don't actually pass out. We just feel like we're about to. So I know this condition well enough in myself to trust myself to be able to do those squats even when I'm not feeling well and know when to stop. So I know that, okay, I did 10, I'm feeling really weird, I'm gonna go lay down on the table now. So I'm responsible about it, even though I say things like I like to punish myself by doing that. I'm also still very responsible about it. So if you're still scared of your broken body and you are still trying to figure out what it can and can't do, just be conscious of that. Don't put yourself in any danger. And that's how we ended physical therapy. I have another session tomorrow, so we'll see how that goes. But today was a tough day. I went from, like, right now my hands are dry. When I was symptomatic, they were very sweaty of the hyperhidrosis, and I'm still really shaky. And kind of coming out of this dizzy, foggy, floaty feeling that I had. So, and you can tell in my heart rate when I'm laying down, doing lying down exercises in physical therapy, and when I am doing standing exercises. And also you can tell when I'm doing a lying down exercise versus like a seated exercise, my heart rate still goes up significantly. And again, just for some context, this is my good version. This is my very well controlled version with medications. What does that tell you? There are a lot of people on the internet who will try to give you random cures for this. And well, this worked for me. It may have worked for them, but it may not work for you. And if it doesn't mean you're not trying hard enough, doesn't mean that you're weaker. It's just that that's how your body is reacting to this condition. And that's the evolution or progression of your version of this condition. So mine, unfortunately, is hard to control. It hasn't responded to a lot of things. So I'm grateful for some improvement, but then other things have gotten worse over the years. So this is where I am right now. Ask me in a year. We'll see how I'm doing. Hope y'all have a good day.